Grey County. This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome as a guest to the program Carol Merton, who is a public health nurse at Grey Bruce Public Health. Today, Kelsey is here to discuss with us harm reduction and the goals of harm reduction. Kelsey, welcome to the program.
Thanks, Carol. Thank you for having me today.
My pleasure. Now, you've been really helpful already because you sent me a bunch of questions that will help to guide the conversation. So you made my work easy. So thank you. And we're going to start and just flow through. But as we chatted just before the program, don't wait for me to ask you a question. This is your program to profile the goals of harm reduction. So first of all, what does harm reduction mean? And what is the role of public health in harm reduction?
Yes, so we usually start off with kind of a basic explanation of harm reduction, which is that it's all about lowering the harms or risks associated with a behavior or an activity. And we explain it that we all use harm reduction in our everyday lives. And examples of this include things like wearing bike helmets, life jackets, sunscreen, and seatbelts. And a really good example of harm reduction this time of year is getting your snow tires put on your vehicle and adjusting our driving to the weather conditions, which is certainly something that we've needed here in Grey Bruce in the last 2 weeks. Yes. And so it's just about doing things or engaging in practices that can help keep ourselves and those around us safer. Now, harm reduction, when we pivot and we look at it in the context of our work and substance use, it's an evidence-based, person-centered approach that meets people where they're at and seeks to reduce the harms associated with using substances. And there's a number of different programs that fall beneath the harm reduction umbrella at Grey Bruce Public Health. Would you like me to kind of go into those different areas?
Oh, please do. Yes. The more we know about it, the better. Thank you.
Okay. So one of our programs that we offer is called the Needle Syringe Program. So through that program, we work with people in the community who may be using substances to help them, number one, be safer, to connect them with needed services, and to improve health and well-being. And the focus is really on any positive change. We also offer something called the naloxone program. And so for anyone who's listening, if they don't know what naloxone is, it's a life-saving medication that can temporarily reverse the effects of opioid overdose. So through that program, our team works with partners to get it out into the community, into the hands of those who need it most, to prevent fatal overdose from opioids. Something else our team does that maybe some people in the community aren't aware of is that we monitor reports of suspected opioid-related overdoses as well as fatalities, and then we issue alerts when needed. So an example of when we would do this, or a time we would issue an alert, would be if we've noted a cluster of suspected opioid-related overdoses in the region. So we would issue an alert to let the community know and to encourage the use of harm reduction strategies to be safer, and also to let people know about supports and services that are available in case someone is interested in pursuing help and support. We also offer education and training on this topic. So this is both to organizations and just to community members as well. And we also offer community outreach alongside many partner organizations. And this is really, so we go out and offer our services with partners on a scheduled basis in different locations, with really the goal of making it easier to access our services. So that's kind of a really quick rundown of our harm reduction program.
So I have a few additional questions. I did warn you I would have some questions probably.
Yes.
So tell me more about the needle exchange program. Do people have to come to public health? And what does they bring in their needles and you give them needles? Like, how does that exactly work?
Yes, so the program is open Monday to Friday, 8:30 a.m. to 4 p.m. No appointment, no referral needed. People can come in at any time. And again, we're working with people who are living dependent on substances to help them be safer. And so this way, it really reduces the burden on our healthcare system. So, what research has shown that if people have access to single use sterile substance use equipment, it can reduce the transmission of bloodborne infections like HIV, hepatitis C, as well as bacterial infections like skin, heart, and bone infections. So, for example, the cost to treat a case of hepatitis C over a lifetime can range from $45,000 to $100,000 per person. The cost to treat a case of HIV can be over $1 million. The cost to manage an injection-related infection in hospital can be approximately $15,000, whereas the cost to put together our harm reduction supplies is only a couple of dollars in range. So without these programs like needle syringe program, where we give people single-use sterile substance use equipment and we educate them about safer practices, our healthcare system would be more strained. So there'd be more 911 calls, more busy emergency rooms, resulting in higher costs, longer wait times, and more lives lost. And this service actually can be accessed. We have a number of different partner sites in the community, and these can be found on the back of our program pamphlet, which can be found on our Grey Bruce Public Health website. And for the most part, there are many pharmacies in Grey Bruce who act as needle syringe program partner sites. And pharmacies also provide the naloxone piece as well.
So it's really spread that the harm reduction program is not just in one local area, it's in different areas where people have better access to the program itself, which is important. You know, we're a large rural area and transportation is a challenge sometimes.
Yes, and I should add, Carol, that the services are also not only offered at our main office in Owen Sound and at our partner sites, but members of our team go out along with SOS or supportive outreach services. And we also take part in Bruce County Outreach. And the calendars for those programs can be found on the United Way's website. But we're out going in different directions all week long. And again, just trying to make it easier for people to access our services.
One of the advantages as well, having the ability to do the needle exchange means that those needles get disposed of in an appropriate way and not in perhaps locations that the general public may not necessarily appreciate. But the harm reduction is also harm reduction for our whole community, not just an individual. Do I have that right?
Yes, for sure. So you kind of hit on a few things there. And maybe I'll start with the first piece that you mentioned. So one of the benefits of harm reduction programs is that it does enhance community safety and well-being for everyone. And that's because a big part of that work involves providing supplies and education regarding the safe disposal of used needles and other substance use equipment. Nice. So we offer a range of different sizes of sharps containers, and we take used substance use equipment back. So for example, last year alone, our program collected nearly 60,000 needles for safe disposal. And that doesn't include the needles that are collected through pharmacies because they have their own take back programs. Yeah. So that's totally separate from the pharmacy's take back. And we also offer they're called outdoor needle drop-ins to community organizations in need. So we've provided 5 of these to community organizations who've expressed interest over the last few years and just worked with them in terms of guidance on monitoring and maintenance of these drop-ins. So there's 2 needle drop-ins in Owen Sound. So there's one on Kearney Lane behind Brexall Pharmacy. There's one behind CMHA Fresh Fruits Cafe. So those are in Owen Sound. There's also been one put in place at the Hanover CMHA location. And there's one in each Indigenous community. So we support communities with the safe disposal of used substance use equipment that way. And then we also offer training and policy development support for organizations who are interested in improving their needle disposal practices and policies, and just general resources on this topic on our website under the sharps disposal section. So in that way, it's not just about improving individual health, but it really enhances community safety and well-being in that way as well.
So these are actual community bins that people can dispose of the needles. Wow.
Yes. So they kind of look like an outdoor, it looks like a big steel mailbox, but it will have a biohazard waste needle symbol on it. Yeah.
Excellent. So I'm sure we could talk for the whole segment about the harm reduction, but I'm really interested in the naloxone, and if you could, that's another area that I think would be helpful to know more about naloxone and how the community can assist.
Yes, for sure. And so naloxone is also known by the brand name Narcan. And it's a medication that can temporarily reverse the effects of opioid overdose. And opioids, examples of those substances include things like fentanyl, heroin, morphine, codeine, which can be found in Tylenols 2 and 3, Dilaudid or hydromorphone, oxycodone, just to name a few. And opioids can come from regulated sources. They're often prescribed by healthcare providers to relieve pain, but they can also come from unregulated sources, and they can be used both medically and non-medically. And in the event of opioid overdose, naloxone is very fast acting, so it works in about 3 to 5 minutes, and it stays active in the body for about 1 hour, after which time it does unfortunately wear off, and the effects of the overdose can return. Now, this is because most opioids last longer in the body than naloxone does. So I like to explain it like, think of it as a temporary tool to buy you time to keep a person breathing until paramedics arrive. It's not a replacement for calling 911. It's safe, it has no addictive potential, and if given in error, it will not cause harm. And it's available, you can get it as an injectable form that you can draw up into a needle and inject it into a large muscle of a body, or it comes in a really easy to use nasal spray device as well that just gets inserted into the nostril, and you simply press a button to deliver the dose of the medication. And it's widely available for free, no prescription required, and anonymously from most local pharmacies and from Grey Bruce Public Health and a number of community partners. And if you go to these places to get a naloxone kit, the training really only takes a few minutes.
So a member of the community, no medical training, sounds a bit overwhelming. First of all, how would I recognize that someone needed naloxone? If I had the kit, you're saying it's okay to give it, but I also need to call 911 as well, correct?
Yes.
Okay.
Yes.
So maybe, yeah, walk me through it as if, I'm a general member of the public walking by, seeing someone. I have a naloxone kit in my purse because I picked one up at a health fair. Walk me through the steps.
For sure. So, and just to let you know, not only would you get training wherever you pick up your kit, but the instructions actually come in every single kit as well. So it's in every single naloxone kit. But signs of opioid overdose include things like the breathing will be slow, irregular, or may have stopped altogether, with or without snoring or gurgling sounds. The fingernails and lips of a person would look bluish, greenish, or grayish due to that lack of oxygen in the body. And then the body will be limp, skin cold and clammy. If you came upon someone and you see that they're laying down, let's say on the sidewalk, you're walking somewhere in the community, you would try to wake them up. So in opioid overdose, if you tap their shoulders, shout, "Hey, are you okay?" really loudly, or apply a pain stimulus like pinching the earlobe, the person will not be responsive. And another sign of opioid overdose is the pinpoint pupils, which is when the pupils of the eye look very tiny. And again, all those signs of opioid overdose are found in the naloxone kit. And so if you're someone who has no medical training, you've probably opted for the nasal spray device, which is very easy to use. So you could, after trying to wake the person up and determining that they're unresponsive and you're suspecting drug overdose, maybe you see a needle or some paraphernalia that makes you think that, or maybe being that it's a small town, you know this individual and a little bit of their history. So you're suspecting drug overdose, they're unresponsive, then you would call 911. And then while you're waiting for paramedics to arrive, you can put on the gloves that come in the kit. You'll open up the nasal spray device package, and with one hand gently supporting the person's head and neck, with the other hand, you'll hold the nasal spray device, gently insert it into either nostril until your fingertips hit the edge of their nose. And then when you're ready, press the red plunger in the middle to deliver the dose. Then once you've pressed that plunger, you can remove it from the person's nose, and that dose is delivered. The person doesn't have to be breathing to inhale it. It is simply absorbed through the membrane of the nasal cavity, because that's a question we often get.
Yeah.
Then you're going to do a little check for breathing. And if you know CPR at this point, this is how you would perform CPR to the level you're trained and comfortable, and a rescue breathing barrier does come in the kit. And then the final step, which is found in the kit, says that after 2 to 3 minutes, you're going to reassess. If there's been no improvement, you will give another dose of naloxone, which comes in the kit. It comes with 2 doses in the other nostril, and then continue CPR and assessing the person until help arrives and the paramedics take over. So that's just a really brief crash course. And of course, when you call 911, they're going to walk you through that as well.
And that's really helpful to know. As a healthcare professional, so open disclosure, but I am a healthcare professional. I am so impressed with the members of the community who have stepped up, learned about naloxone, willing to carry naloxone. And, one of the questions that you sent me was, how can people support those in their lives who are engaging in harmful substance abuse? That's one way, right? To carry naloxone kits and be willing, to call 911 and help the individual in that moment. The community is protected by law. It's called the Good Samaritan Act, right? So that, basically anyone can help.
Yes, for sure. Anyone who calls 911 in the event of an overdose situation does experience or get some legal protection. And the law was put in place to encourage people to call 911 to save lives. So for example, it does provide some legal protection. Say if a person had a small amount of drugs on them for personal use, they would be protected in that situation. And it's really just to save lives.
Exactly. So on that topic about saving lives, and I know I've seen the releases from public health about, warnings really that there may be some supply out there that may be toxic. Where are we now in Grey Bruce around the opioid trends and, what's happening with overdoses? Or do we call them overdoses or do we call them poisonings? I hear different terms. What do you call them?
I actually use those terms interchangeably,
Okay.
and it just depends on the audience. I find most people understand what overdose means, and so I tend to use that more often, but definitely I hear it used both ways. Um, but yes, so an update on trends in the region. So in 2025, we are seeing a significant decrease in suspected opioid related overdoses and fatalities in Grey Bruce. So, what we have noted is when we look at January to September of 2025, we've seen a 67% decrease in suspected opioid related overdoses and a 73% decrease in suspected opioid related fatalities compared to the same time frame in 2024, so January to September 2024. So we do hope that these trends continues, and we always also want to acknowledge that, you know, these are not just stats, they're people who have people in our community who are grieving the loss of these individuals. So we just want to acknowledge that. And ultimately, the goal would be zero overdoses and fatalities, but the trends are going in the right direction. So that's great to see. And our team develops these public friendly infographic versions of the trends, and we post them on our Grey Bruce Public Health website under Your Health, Opioids and Overdose, and then Opioid Crisis, a quarterly snapshot. So people can visit our website to stay up to date on those regional trends if they're interested.
Now you have my curiosity piqued. First of all, great news. The trending is going down. So that's great news. My curiosity is what's happened? What's different that we're seeing this result?
Yes. So the reasons for this are many and complex. There's not one reason. And I will note that this trend has been seen not only in Grey Bruce, but also from BC to Ontario, so Western Canada in 2025. And so lots of factors involved. Locally, we know that we've had such a significant growth of services for people who use substances in our region in recent years. So things like SOS or supportive outreach services in Grey County, Bruce County Outreach, the Wellness and Recovery Center, the expansion of rapid access addiction medicine clinic locations, and more. And so without this growth of services locally, we may not have seen as pronounced a decrease in overdoses and fatalities. So we're truly fortunate locally to have those services and that spirit of collaboration amongst partners to help make these services happen. And some other reasons that have been cited in the literature include things like this drug toxicity or opioid crisis has been going on for so long that the population of people who use drugs is decreased due to the many fatalities, that the deadly consequences of this crisis may have really put a spotlight on our harm reduction messaging and led to people using safer practices. We also know that there's increased availability of some harm reduction services, like naloxone is widely available. There's new services like drug checking, mobile services, and there's the new types of addiction medicine available. Other reasons that have been cited include things like increased uptake of addiction treatment, fewer youth initiating substance use, and fewer opioid prescriptions available in communities. So there's not one factor, but there's many factors involved. And again, we're just so fortunate locally to have the services that we do. And it seems like we keep building on and expanding and really working together to create greater access for people.
So I think really that it is a positive message that harm reduction and the goals of harm reduction are saving lives.
Yes,
Yeah.
for sure.
Now, I wondered about one of the things you talked about earlier. When people bring in the needles or when, people come in perhaps to get naloxone, if they're a user even, they would they would certainly have that access to naloxone. But to me, that's an opportunity for a door to open for a conversation and support. And I'm wondering if you can talk a little bit about the importance of connections and conversation and the timing of those.
Yes, for sure. So you've hit on another major benefit of harm reduction initiatives there. It really does offer a pathway to treatment and recovery in addition to saving lives. So we know that by meeting people where they're at in terms of their substance use and developing trust and rapport with people, it can help us reestablish connections for those people to mainstream medical and social services in the community that they might really need. So that relationship building does take time and effort, but it's worthwhile in the end, because studies show that people who access harm reduction services are actually 5 times more likely to engage in substance use treatment services than those who do not, which is pretty incredible. And last year, for example, our program, the Grey Bruce Public Health Site, made 62 referrals to health and social services in the community, which is great. And then just in regards to this, there's a quote our team likes to share when we're doing public education. It's from Dr. Kieran Moore's Balancing Act report. So Dr. Moore is the Chief Medical Officer of Health of Ontario. But what he says in that report is that when you have harm reduction responses in place in communities, people may then be able to benefit from offers of things like education and treatment, and to take steps that enable them to stop or reduce their substance use. So yes, it offers a pathway to treatment and recovery and reestablishing relationships, for sure.
And you know, in other words, there's no wrong door. There's a regional collaborative approach, and you're meeting people where they're at. And we're seeing the benefits of that in the trends going down. I cannot believe that our time is up. It's been I know it's been fascinating and certainly positive news around the trends through all of the hard work of everyone, public health and all of the agencies and the community as well, who are willing to support. Kelsey, thank you so very much for being on the program. It's been a delight to speak with you. And I do hope that you will come back again and give us more updates on harm reduction and certainly the impact in Grey Bruce. Thank you.
Thank you so much. Bye.
Thank you to our viewing and our listening audience for joining us today on HealthLink. We've been speaking with Kelsey Merton from Public Health, and we've been learning about the goals of harm reduction. Please tune in again to learn more about programs, resources, and services that are available to you and to your family. Take care and stay safe.
Connect with us by visiting our website or email us at comments@rogerstv.com.
With Rogers TV, you can cheer on the home team from the comfort of your living room. We'll head to the rink, the field, the court, or the pitch, so you don't have to. Tune in and cheer on your local amateur athletes on Rogers TV.
Are you a passionate content creator ready to expand your audience reach? Do you have unique stories, captivating hobbies, or special interests that deserve a spotlight? Rogers TV is here to amplify your voice within the community. We offer you the platform to broadcast your content to a wider audience.